Miss Anne, a 70-year-old woman, has been having severe pain in the right calf for the past 2 weeks. Her physician Dr. Alex referred Miss Anne to Dr. Raghu as he had suspected deep vein thrombosis. Dr. Raghu ordered a duplex ultrasound which confirmed the diagnosis. After a detailed examination of Miss Anne, Dr. Raghu suggested that inferior vena cava filter would be the best strategy for her to decrease the risk of pulmonary embolism, which is a life-threatening complication of DVT. Venous thromboembolism, which includes deep vein thrombosis and pulmonary embolism, affects 1 to 2 individuals per 1,000 annually and is a leading cause of in-hospital deaths. DVT is more commonly diagnosed than PE, but mortality from PE is twice that of DVT. Anticoagulant is the mainstay to treat PE and DVT. An inferior vena cava filter is a small device that is placed in the IVC that prevents blood clots from entering the lungs. This procedure is commonly indicated for patients with VTE in whom anticoagulation is contraindicated or it fails. Classic indications for IVC filter are absolute contraindication to anticoagulation, complication of anticoagulation needing cessation of therapy, failure of anticoagulation and progression of DVT during anticoagulation. Expanding indications with DVT include diliocaval or large free-floating proximal DVT, difficulty in establishing therapeutic anticoagulation, massive PE treated with thrombolysis, chronic PE treated with thromboendarterectomy, VTE with limited cardiopulmonary reserve, recurrent PE with filter in place, poor compliance to anticoagulation and high risk of anticoagulation complications. Expanding indications without DVT include trauma patient with high risk of VTE, surgical procedure in patient with high VTE risk and medical conditions increasing the risk of VTE. IVC filter can be classified as temporary and permanent. For IVC placement, first, a small incision is made in the neck or groin region and a catheter is inserted to access a major vein leading to the inferior vena cava. Next, the IVC filter is passed through the catheter and released into the IVC. Then, the filter is expanded and attached to the IVC walls. Finally, the catheter is removed. After the IVC filter placement procedure, Miss Anne was given care instructions for home and was discharged. She was asked to rest for a day and then resume normal day-to-day activities. Dr. C Raghu at Aster Prime Hospital is the best doctor to treat vascular disorders. The team at Aster Prime is highly competent to treat patients with complicated venous thromboembolism, and we also have facilities like 24/7 cath labs for assessment of VTE, Philips cath lab system which is the best in the world, and a highly trained staff. You could contact Aster Prime by direct appointment, through video consultation or through website.